Welcome to the talk for the Dr. Job Summit. This talk is being sponsored by GP Synergy, which is the general practice training provider for the New South Wales and ACT jurisdictions. And if you are watching on the replay, on the event page, you can actually put a question as a comment as well, and we'll see that and get back to it to you and answer you in that format as well. I wanted to introduce you to Dr. Vanessa Moran, who, as I said, is the current Director of Education and Training for GP Synergy across the ACT and New South Wales. Vanessa is a GP in the inner west of Sydney, where she's been working for over 10 years. And she's also been working as a medical educator for 9 years with GP Synergy, and has talked at past live workshops that we've run for Advanced Med as well. So I'll hand over to you, Vanessa. Welcome.
That's wonderful. Thanks so much, Anthony. So welcome, everyone. It's great to have you here live tonight, and also if you're catching up online afterwards as well. So hopefully we can answer a lot of your questions. I'd like to start by acknowledging the traditional owners of the land of which we're all meeting on tonight. And as we meet here on the many nations known as their respective countries and homes, we would like to acknowledge the many traditional custodians of these countries who have a long-standing cultural heritage and relationship with the rivers, lands and seas. I'd also certainly like to pay my respects and our respects to our elders past and present, and I'd really like to extend that respect to anybody here tonight or who's watching this who may identify as Aboriginal or Torres Strait Islander. So welcome everybody. I am actually tonight on Awabakal land. I have moved from the inner west of Sydney to Newcastle. I'm working for GP Synergy up here, and I'm going to jump into some clinical work in Newcastle now that I've moved up here. So we are going to have opportunity for questions. I really like to make this as relevant for you as possible. So there's lots of information available on GP training, particularly in the GP Synergy applicant pack, and we'll give some information about that later. But I'd like to really contextualise that information for you. So that's my plan tonight. So if, as Anthony mentioned, if you've got any burning questions, pop them in the chat now. It will really help me make sure that I do cover those within the chat. Sometimes, of course, you don't know what you don't know. So I've certainly got some slides here to go through just to give you a bit of a teaser and give you a bit of an understanding of general practice training. So for me, I am a GP first and foremost, and I did my training in Moran, in a rural town, as well as in Sydney, back in 2006 to 2008. I also did some additional upskilling in paediatrics back in those days as well. I absolutely love general practice. I love that opportunity of that continuity of care. I love looking after children, watching them turn into teenagers, and also watching them get pregnant and have babies and so on and so forth. So that's been a really wonderful journey for me. I also love teaching, and so one of the things I did become soon after GP, my training finished, was to become a medical educator, and that of course has brought me to the role that I'm in today. Again, I absolutely love the role of medical education. I love that, as a GP, you want to give your patients lots of knowledge, and as a medical educator, you can train supervisors up to train GP registrars that are training our doctors of the future in general practice that are leading to healthier communities. So I really love that part of the role as well. So as Anthony mentioned, I work for GP Synergy, and GP Synergy delivers the Australian General Practice Training Program for doctors in New South Wales and ACT. And what is that program? That program is a government-funded program for you to get your fellowship with either the Royal Australian College of General Practitioners or the Australian College of Rural and Remote Medicine. So we're, of course, quite big. We cover all of New South Wales and ACT, and we have a number of training regions and training sub-regions. And we'll talk a little bit more about those later, especially if anybody is interested in that in particular. So anybody here already thinking about doing a bit of general practice? Any thoughts about whether you might be interested? I certainly didn't think of it myself initially. I didn't have a great medical student placement as a GP med student. I was sort of bundled in the corner and told to go and play golf instead, which was kind of great, but at the same time really didn't give me that real understanding of just the breadth and depth of medicine, the continuity of care, and that really whole person, holistic care. So I think if that's something that's interesting to you, if you like variety, if you want to expose yourself to that real diagnostic challenge of medicine and perhaps to develop relationships over time, then this is a great opportunity. You can, of course, a little bit like I did as well, is to do a bit of sub-specialising. So certainly while general practice is of great interest to me, I'm very much interested in antenatal care and children's health. So I certainly spend a large portion of my clinical practice focusing on that as well. So often when you are in the hospital system, you don't always understand exactly how you might become a GP or how you might specialise as a GP. You're kind of hanging out with maybe a surgical trainee and an anaesthetics trainee or a psychiatry trainee, and you get to talk to them about what that's like. And sometimes it can be a little bit unknown. So I am going to touch a little bit on how you might specialise as a GP. And of course, the most common way is to train with the Department of Health funded AGPT program. And that program funds about 1,500 places per year. So this is training that's paid for you. So that includes things like paying for supervision for you. So that's dedicated supervision. It gets paid for protected teaching time. So you actually leave the practice and you're paid for that teaching time. It's not just smooshed into a lunchtime somewhere that may or may not happen. We have an out-of-practice education program that's run specifically to contextualise what clinical knowledge you already have into that primary healthcare context. You have access to your own personal medical educator. It's probably one of my favourite things to do about this job is to mentor a registrar through from the first meeting that we have with them when they've started all the way through to the completion of fellowship. And I've certainly mentored many, many registrars who are now supervisors or perhaps also medical educators. So that one-on-one mentoring by a dedicated, trained educator is really something that's quite unique to general practice training, and something where they will help you make sure that you are meeting your curriculum requirements and are able to help with fellowship assessment support. So one of the things with the AGPT program is that, in particular with GP Synergy, is that we are consistently above the national average pass rates for the college assessments. So something really also to be aware of. And as I said, federally funded as well. Sometimes what's a little bit confusing is the two pathways, and the main difference for them really is that the College of Rural and Remote Medicine has a unique focus on rural generalism and rural medicine, and has a compulsory year of additional skills training. So it's a 4-year program. The Australian College of General Practitioners is also a program to become a fully qualified GP. Its focus is on all of medicine, so both rural and urban, and you can do an optional year of skills training called the RACGP. So one is just a little bit more focused on rural, but certainly for both of them, you can work as a rural GP. So as I mentioned, I didn't mention, but the RACGP fellowship is 3 years, and you can do the RACGP fellowship on the rural or the general pathway. And that 3 years consists of 12 months of hospital time and then 2 years of GP time, of which 6 months of that can be extended skills in general practice or in a community or a hospital setting. So something like you might do it in a sexual health clinic. There's that optional year I just mentioned, the RACGP, and you can actually apply to reduce your training time by up to 12 months. So that's called recognition of prior learning. And so that's usually for your hospital time. And I can talk a little bit more about that a little bit later. You definitely have to do some mandatory terms. And of course, you have to sit your fellowship exams just like any other specialty. And the requirements for GP training is to do that after your second GP term. So with ACRRM, this is rural pathway only. Remember I said this is a really rurally focused college. There is 36 months, so 3 years of core generalist training, which includes both hospital and general practice time. And that's quite fluid in the way that works, plus that compulsory 12 months of advanced specialised training. And that's in a number of disciplines, so everything from anaesthetics to emergency, Aboriginal and Torres Strait Islander health, an academic term, palliative care, lots of options for that. For ACRRM, you can reduce your training time by up to 2 years. So that's 2 years of recognition of prior learning. Again, there's certainly some mandatory terms that are required to be completed, and they can be completed during your training as well. Similarly to the RACGP, there are timeframes for you to sit your fellowship exams, and there is a minimum rural, very rural requirement. That means MMM 4 to 7. So we're not talking about a regional town here like Bathurst, Dubbo or Orange. We're talking about a smaller town such as Cowra, Parkes, Moran, etc. So if you are interested, I would strongly encourage you to apply this year, even if you're not 100% committed. Our applications do close very soon, so in about a week, which is why we're running tonight's webinar. You can apply as early as your intern year, so don't be put off by that. And I've certainly seen lots of fantastic applicants in intern year. One of the great things about being on the program is that you get a little bit more of an understanding of it. You can remain in the hospital for your first year, so you can still sort of I guess have your foot in one in each camp for a while until you're really committed to either general practice or perhaps another specialty that you'd like to pursue. So I do strongly recommend that you jump on board and give it a try. There's really not a lot to lose. So Anthony, have we got any particular questions to cover so far? I think some issues with hearing, but seems okay. I'm going to cover.
I was just going to say, yeah, I think that might be because that person's using an iPhone or something, but everyone else seems to be able to hear okay. And I'm supposing everyone on the chat is saying they're thinking of doing general practice, so that's good. You're at the right session. We'd be really keen to find out if you've got any specific questions. I put some questions together for Vanessa tonight based on some of the common questions I get. But if you do have a query or a question about the process or what it's like, or any myths or things you might have heard, now's your chance. So please put them in the chat, and I'll look out for them, and I'll feed them to Vanessa.
Brilliant. Feel free to interrupt me. So yeah, as Anthony mentioned, these were some top FAQs, and these are certainly ones that I get asked a lot as well. So I think they certainly resonated with me. I'm very happy just to keep running through those. So the first one was around how will GP Synergy make sure I'm ready to start seeing patients in my first GP term? And I think that's a great question. Remember, as I said, sometimes we're not really quite sure what general practice is like. Maybe we haven't had a great medical student experience, or the only experience we've had is with our own GP. So, what is it like? And certainly I can reassure you that there is lots of support and many conversations before we throw you into a room. We don't throw you into a room. So a little bit of a common training scenario for both of the colleges here. So for RACGP, in general, that first year is in hospital, and you're getting a lot of those basics that you really need in general practice. And that's things like how to recognise a sick patient or a sick child that might walk into your door. How might you manage some really common medical problems like chest pain, and maybe some surgical problems like, a wound dehissing or some wound dressing. So that having a really solid first year is probably quite key, and that's for both colleges really. That year of core generalist training in the hospital is again for ACRRRM another really solid start. Now some doctors choose to continue with their hospital training for a little bit longer to get a bit more experience, and that can count towards GP training. So for RACGP, you can count that as extended skills. So for example, I did extended skills in paediatrics, and that gave me an additional amount of time in order for me to gain some more specific skills in that area. In ACRRRM, you might choose to do your advanced skills year first in that hospital time. So again, you might be getting a whole year's worth of emergency skills before you're heading out into your first GP term. So that's called GPT1 for RACGP, and it's one of the core generalist terms for ACRRRM. So generally, some good hospital solid experience and having your mandatory terms met, which we'll talk about in a minute, is really what we're mostly looking for to start in general practice. And that's because you don't start out there alone, you start out with a supervisor. So when you get onto the program, you have your first meeting with someone like myself or Nadia Clifton here, who is our head of pre-vocational education. And, we'll have a long chat with you about where you've been, what you've done, what your experience is, where you're heading, and how we can fill any gaps in the meantime. There's some really key things like having CPR and being able to recognise an ill patient that we want you to be pretty down pat with, I guess. And we can also talk about, how you might meet your fellowship requirements too in that meeting. So after you've had that first meeting, we've got lots of things for you to do while you're in hospital. So usually we catch up with you in about August, September, but you don't start in GP training until at least February of the next year. So there's lots of time for you to access our orientation and GP training modules. We've got modules on childhood immunisation, Medicare and billing, which are often really unknown things for GP trainees. And then just some really basic other things like consultation skills in general practice and prescribing in general practice. So lots of little things for you to do in your own time while you're getting ready and getting prepared. And they're also tailored to yourself. So if you've done some immunisation before in a past job, then you might not need to actually do that module, for example. So the other thing we do is something called our pre-GP term assessment. And this is, it's not a barrier exam, it doesn't stop you from going anywhere, but it's a really great little quiz that gives you some really key tips on what you might know and what you know really well and what you might not know very well at all. So for example, if you've done a year of adult emergency, you're probably going to answer the chest pain questions really well. But you might not answer the identifying a sick child very well. So it might pull up for you that you've got some specific learning needs. Now that helps you, your supervisor, and your medical educator plan your learning in those first few weeks. So the supervisor will say, hey, you haven't seen many kids. Every time you see a child, I want you to make sure that I run my eyes over them before they leave. And we're going to do that for a couple of weeks until we're both confident that you're going to be able to manage that. So that's a really common scenario for our GP trainees. I mentioned earlier that we do have a dedicated education program. So if you're a full-time registrar, there's 18 days where you come to GP Synergy in one of our local hubs. So for example, if you're training in the Moran region, you'd go to our Wagga sessions. If you are training in the North Coast, you might go to one of our Ballina sessions, and so on and so forth. We also run virtual Zoom sessions too. Now, this is paid out of practice teaching time. So those 18 days are actually paid days. And we've got a little couple of examples there of what some of those days might cover. Things like, as we said, introduction to training, dermatology, all those things that you don't quite always see in the hospital. And the main thing for us in this education is to contextualise it to primary practice, because we know that you've got lots of experience quite often, and sometimes, quite significant experience in a particular area, such as O&G or surgery, for example. So it's really about contextualising that clinical knowledge to primary care. When you're in the practice, who's one of our wonderful supervisors here, they have set aside teaching time as well, and that grades depending on what stage of training you are. So right at the beginning of your training, that's 2 hours a week of mentorship and support, and 1 hour a week of face-to-face formal teaching, like a little mini lecture or something. They also do direct observations of consultation, so they come and sit in and watch and give you a bit of a critique. We also have external teaching visitors that come in for a session, so they'll come in for 3 hours, either Zoom remotely or face-to-face, and provide feedback on how you're going as well. And of course, your medical educators provide you some training and education advice throughout your time as well. So lots of support there. Oh, I mentioned that already, so that's that supervision. The supervisor's always there at least 80% of the time at the beginning, and then that grades up as we go along through training. Really like any other program such as surgery, the consultant's not going to let you do that appendix on your own right at the beginning, but certainly after a few goes, you get to do it all on your own. Another few points to consider. Your terms are going to start in either February or August if you're going into a GP term. So while you're in hospital, have a think about the things that you'd like to kind of get on top of and master as well. So if we haven't had any more questions to kind of drill into that one, I might move on to your next question, Anthony, about mandatory hospital terms. Sound good?
Yeah, that's good. We've got a question about IMG pathways to training, but we might leave that to the end.
Sounds good.
Yeah.
Sounds good. So we've got next question was about mandatory hospital terms. So they're things that we absolutely have to do, and that's a really common question as well. And of course, can some of the stuff that I've already done count towards my training time? And I've hinted at that can as well. So for RACGP, we do want to make sure that you've done some mandatory terms. And again, the real key for that is to make sure that if a sick patient walked into your door and your supervisor wasn't standing over your shoulder, that you'd be able to recognise that they were unwell. So we have mandatory requirements for medicine, surgery, emergency and paediatrics. And these we really want to make sure that you've got under your belt before you start in your GP term. Now, I'm not going to go through all of those requirements. They are very clear on the GP Synergy website as well as on the RACGP website. But I think something to know is that there are ways to meet those requirements outside of just doing a 10-week term. GP Synergy does have some additional ways that you can meet those requirements. We're really happy to talk through those as well for you. For PEDS, as I mentioned, there's a little bit more involved with the paediatric requirement. And again, lots of great information on the RACGP website. If you just Google RACGP Paediatrics, that's the first thing that comes up about their requirements. So I won't go into this slide in great detail. For ACRRM, because the way their curriculum is managed, the core generalist training is very fluid, as I mentioned. So really, they want to make sure that you've achieved that breadth of the curriculum over the entire time. And that's because ACRRM trainees often dip in and out of hospital systems to make sure that they've back into general practice, to make sure that they've got lots of emergency skills and secondary skills, as well as their general practice skills. So similarly to the College of GPs, ACRRM has lots of great information about mandatory terms in their training handbook, and you can look that up. It's really clear. So again, ACRRM mandatory terms, and that will come up for you. PEDS is quite similar in that they, again, really want you to be able to recognise a sick child. The Sydney Child Health Program is really valuable for both colleges and just really valuable for general practice in general. So if it is something that interests you and you've got some spare time, that might be something you might want to enrol in while you're still in hospital. And again, please have a look at that ACRRM handbook. Yeah, look, I think nobody wants to miss a sick child, so certainly that's paediatrics is a mandatory term to make sure that we don't miss sick kids. And really you want to focus on things like identifying a child that's having a fit or that, you know, might have meningitis or that's really quite unwell that you don't really want to let go home. So I mentioned that recognition of prior learning. For RACGP, you can have apply for 1 year of your hospital training to count towards recognition of prior learning. And that can't be in the one discipline. That needs to be over a range of disciplines, generally only a maximum of 6 months in any one discipline. So you might do 6 months of ED, for example, and then a term of paediatrics and a term of medicine. For ACRRM, you can do up to 24 months of RPL, and that can be for hospital settings. It might be for your advanced skill. We have lots of ACRRM trainees that will get recognition of prior learning for 12 months of hospital time, and then also for 12 months of, say, for example, emergency, and count that towards their emergency advanced skill. That's quite a common scenario for us to see. GP Synergy doesn't determine whether you are eligible for RPL. What we do, though, is help work with you to get your RPL application together, and then we submit that to the particular college for approval. Couple of quick points about recognition of prior learning. It does need to be in Australian hospitals, and they need to be approved terms. So if you're in New South Wales, that's a HETI approved term, or if you're in ACT, it's in one of the ACT health approved terms. It can't be a locum term because we're looking for terms that have supervision and education. They have to be clinical posts only. So I know some doctors these days are doing medical admin terms, for example, and those can't be used for recognition of prior learning or to count for training time. And of course, we want it to be relevant to general practice. Now, most things are relevant to general practice, you'll be glad to hear. For that 12 months, some of that time can be leave, and that can actually be up to 7 weeks, which is sort of annual leave and sick leave. you've got to make sure that you apply by particular deadlines, but we'll walk you through all of that when you're on the program. For RPL for ACRRM, there are some slight differences, so it does need to be within the last 7 years. And again, mostly Australian and New Zealand hospitals. On occasion, Canadian or English hospitals have been taken, but not very often. So again, usually Australian practice is relevant. Oh, and again, also clinical posts only. So for more information, there's lots and lots of information on the website, but of course, if you jump into the GP Synergy website and have a look at our publications and news, and all of our policies and forms are in there, and there's lots of information in particular about meeting those mandatory term requirements and recognition of prior learning. All of that information is there and you can access that if you need to. So, Anthony, just checking thumbs up to move on to the next question. Beautiful. So, another really common question is about taking some leave or going part-time, and does that work? Is that possible? Can it affect your training time? And absolutely, you can certainly take leave, and there's lots of different leave requirements for GP training. There's the, things like sick leave and annual leave, all that statutory leave that's really absolutely standard. And then there are sort of more, some longer leaves like maternity leave or longer sick leave, again, that are available. And then, of course, there's leave just to go and do whatever you want to do. So we're going to talk a little bit about those different types of leave. So sick leave and annual leave are just managed within your training time. So you have every 6 months, 2 weeks of annual leave and a week of sick leave. Now that's just part of your employment agreement, and that actually counts towards training time. Leave that doesn't count towards training time, but that you're absolutely entitled to, is additional sick leave, maternity leave or parental leave, and we call that category 1 leave. And of course, you're allowed as much of that as you need, as determined by the documentation that you provide. Now, of course, if you're on sick leave or maternity leave, it's not expected that you'd be doing other work at that time. We'd expect that you would be on leave. So that's our category 1 leave. That's uncapped. And obviously for maternity leave, we've actually got up to 2 years of leave per child on the program. That's unfortunately unpaid leave most of the time, because you're usually in a general practice and you've not usually been there for more than a year. But that does vary. And but again, you can take up to 2 years per child off the program with no penalty at all from the program's perspective. And of course, we're able to help you return to work. Category 2 leave is additional leave, and that can be for really any reason. So if you want to go travelling, excuse me, or if you wanted to go and maybe decide Anthony's lured you into doing some psychiatry, so you're going to go and work and do some psych for 6 months, and you want to not count that towards training, but you could take that as leave and go and do some work as well. This leave is capped at 6 months. You can apply for over that 6 months for extenuating and unforeseen circumstances. And it does add to your cap. And what we mean by your cap is that for the 3-year program, we want you to finish your training within 4 years. And for that 4-year program, we want you to finish your training in 5 years. So that's a Department of Health cap. But there's still plenty of time to complete your training. In general, we lumped this sort of question in here about transfers, because that's another very common question that we find, is that you've entered the training program in a particular sub-region. Let's say you've accepted a place on our Lower Eastern and you're in Wollongong, but you've actually really want to go and do some work somewhere that there isn't a facility in Wollongong, then you can transfer to perhaps Sydney, say, to do a sexual health term, for example. There may also be some unforeseen circumstances that might mean that you need to transfer. So perhaps an unwell relative or a partner's job transfer that's unforeseen. And then that may also make you be eligible for a transfer. You can't transfer within that first 6 months of training. And there are lots of different types of transfers as well. I think the number one thing to understand, though, is that you can't transfer for something that was known on the program. That's considered a backdoor entry. So if you've joined the program in an area that you didn't want to train in, but you just wanted to get into the program, and you just took that spot so that you could secure a spot, you're not able to transfer into another region because it's a merit-based application system, and it's kind of like trying to get in through the back door. So you can only transfer if there's a new unforeseen circumstance that arises once you've already joined the program. So again, you can train part-time. It's very flexible GP training. You can work a minimum of 14 and a half hours for RACGP and 16 for ACRRRM. You've got to work over a couple of days a week. And your training time is pro rata. So if you work 14 and a half hours a week, then your training time ticks over quite slowly. But if you're part-time and you're working 28 hours a week, then your training time does tick over a little bit faster. So we count full-time as 38 hours and your training time is pro rata from that. So if you're working 19 hours a week, then instead of it being a 3-year program for ACRRRM, it would become a 6-year program. But very flexible to do that. You just need to let us know. Now, another common misconception is about extended skills and rural generalism. So what is an extended skills term? This is kind of question 4, 5 and 6 together. And is it different from a rural generalist term? And I think the first thing to talk about is what is a rural generalist? There is a lot of talk in the media at the moment about rural generalism, and that's because we're really trying to make our medical community aware of this really unique, almost sort of subspecialty of general practice. Certainly, both ACRRRM and RACGP are working together to make rural generalism a subspecialty of general practice, just like gastroenterology is a subspecialty of physicians. So rural generalism is a doctor that's specifically trained for general practice, but also for additional skills like emergency and maybe for a particular skill that meets a community need, much like Rachel here, who is has additional skills in anaesthetics as well as her skills in general practice and in emergency. So rural generalist training can be done on both pathways. So I mentioned the ACRRRM pathway earlier, also the RACGP pathway with RGP. And there's lots of different disciplines, paediatrics, anaesthetics, mental health, Aboriginal health, obstetrics, gynecology, lots of things. So again, our website has lots of information if you're interested in procedural training or rural generalist training. So what does that mean for extended skills then? Extended skills is a term, or a 6-month term within the RACGP training program. And that extended skills term can be in whatever you would like it to be. It can be done right at the beginning of your training, or it can be done right at the end of your training. So you actually don't need to worry if you don't know what you want to do in extended skills, because that might just come to you as you go along. So a common training scenario, this is that very top one that I mentioned earlier, is that you do your year of hospital training and you might do extended skills in hospital like paediatrics or emergency, and then go on to do your 3 GP training terms. So that's one of the most common. Probably the most common is actually to do hospital training time first, move into GPT 1 or your first GP term, and then do extended skills in general practice. So, for example, you might do extended skills in general practice with a focus on dermatology. Again, a very common extended skills to do. Or you might still do an extended skills in sexual health, or it might be in aged care, for example. And you'll work with your supervisor on that skill, and you might do some additional courses in that as well. Scenario C might be working in hospital, starting your GP term, and then thinking, hey, actually, I'd really like some more skills in palliative care, because it turns out I've got quite a few palliative care patients where I am. So I'm going to do extended skills in a palliative care unit, and that becomes extended skills in community, and then going back out into GP terms. And that community extended skills can be done at any time. So you can see there that really you don't need to make that decision about what you might do for extended skills right up front. You can take your time and think about that. If you're in a GP practice, you might stay in the same practice that you were in your earlier terms, because that might actually be the practice you've decided you want to stay in once you've fellowed as well. And I've already mentioned the majority of those extended skills. Some other things might be, we've got a couple of posts in the jail, so custodial health, certainly mental health with things like Headspace, lots of other great examples as well, family planning. The community settings, we said anytime generally after GPT-1, you can do those full-time or part-time. Again, we've got lots of really interesting terms. One of the ones I haven't mentioned is the academic term, so you can do an academic year in both of RACGP and ACRRRM, but your extended skills can be an academic term. You might choose to learn a bit more about medical education and be a registrar medical educator. So lots of really great options as well. Hospital settings, again, you can usually do that straight after your hospital year. Be mindful, not all RTOs do provide this option. So if you're outside of New South Wales and ACT, extended skills in hospital might not be an option. It is an option in New South Wales. And it might be an extended skill in a hospital setting, just related to what you're actually doing in hospital at the time. So whatever rotations that you've been allocated. Just mindful of time, I want to try and make sure I get through all of these and perhaps get to that last question from the audience. Let's skip through that one. So this one is in particular for our international medical graduates about training on the rural pathway and the moratorium, but also relevant to registrars training in our general pathway or Australian medical graduates, as I will be talking a bit about our regions.
This might be a good time to ask the question, Vanessa, from Emma. So Emma says, I'm an IMG, I've been in Australia for 2 years, has passed the AMC1, has a PTE academic and 3 years of experience in anatomical pathology. So the question is, am I eligible for AGPT, or do I have to pass the AMC clinical at first? My take on that is that you're not eligible at this point. There are some pathways if you've got some prior general practice experience, but I think Emma would need to complete the standard pathway requirements first to get into the AGPT program. But I'll let you chime in on that one, Vanessa.
Yeah, no, you're absolutely right. So we do need you to have that AMC too. And I think you mentioning that anatomical pathology, again, that might mean you haven't got enough experience within the hospital system for other terms such as emergency. So those things I think are something to explore as well. You will need to have full general registration before you start on the program as well. So you need to have cleared your exams and have your full registration before February 2022 to start on the program. So if that's not going to happen, that means that you won't be eligible to apply for the program. But those sorts of questions are really common questions, and those really individual questions we are able to answer. So if you do email us at applicant@gpsynergy.com.au, we're always really happy to take those individual specific questions as well. I will have that up on the slide at the end of the talk, but just to repeat that, that's applicant@gpsynergy.com.au. We do love to hear from you and answer those questions on an individual basis as well, because sometimes they can be quite specific.
So if we roll the clock forward a bit, and we're now maybe assuming that Emma has completed his certificate and done a resident year somewhere in a hospital and gained general registration, I guess the question then is he subject to the 10-year moratorium?
Yes, I think mentioned 2 years in Australia. I think the answer would be yes. So I'm sure that's very well known to those of you that are on the 10-year moratorium or the 19AB Health Insurance Act, as it's more formally known. So that is a 10-year requirement to work in a restricted area, so an area of need. And you can actually accelerate that time. You can actually do it in less than 10 years if you actually work more rural or more remote. And that includes training time. So we do have a number of our registrars that are working in our rural locations during training to reduce that 10-year period as well. It is the clock starts from the moment that that first registration is granted. And once, of course, you've completed your 10-year moratorium, your time is done, and you have the same rights as a fellow that isn't subject to that moratorium if you've got your fellowship. So we do often call that the 10-year moratorium. So if you are on the moratorium, you must train on the rural pathway, and that means modified Monash model areas 2 to 7. So for an example, where I am in Newcastle, that's MMM1. Places like Wollongong, Canberra, Sydney are all MMM1. Places like, there's not many MMM2s in New South Wales actually, so sort of Campbelltown Way is MMM2, and then MMM3s are places like Lithgow, Orange, Bathurst, Wagga Wagga, Port Macquarie, and then we start to hit the smaller towns. And really that's related to the size of the community and related to the healthcare available, so the type of hospital that's there. If you get an opportunity or you want to know more, there is a Doctor Connect tool, and if you can just Google Doctor Connect, and that tool will come up, and that shows you a big map of Australia and where MMM is. If you are a New Zealand doctor, you are not subject to the moratorium. So you can apply for some exemptions to the moratorium. So there are spousal exemptions and other exemptions. Now, if you want to train in Sydney or Canberra or one of those MMM1 locations, you have to get your 19AB exemption before you apply for training. So for those of you that are watching this, it'd be unlikely that you'll get your 19AB exemption through prior to applying on the 20th of April. So you might have missed the boat for that. but that doesn't mean that you can't start to get that organised now and apply. There may be a second round later on in the year. There's often a second round of applications, or perhaps even holding it over for next year. So certainly that's a possibility. If you are granted a 19AB exemption, you still may need to work in a rural location or an outer metro location. That depends on your training location obligations of the sub-region that you're in. So where do you train? You get to choose where you would like to apply to. Over in New South Wales, we've got our northeastern, our western and lower eastern New South Wales, but of course you might be watching from WA and wanting to apply to WA. And so, you can apply to any one of these training regions. And each one of those training regions has their own sort of what we call distribution of registrars, or how registrars might be training in those practices. So if that's not with GP Synergy, I strongly recommend you jump onto the website of that training organisation and find out a little bit more about where you might be training if you're in one of those other states. I mentioned those 3 training regions, so I'm going to move on. So here they are again. Because New South Wales and ACT is such a big area, we want to make sure that registrars have some certainty about where they will be training. So we've broken those larger areas into smaller sub-regions that are actually much more manageable and much more, I guess we're able to have a local teams. We've got a local office, local medical educators, local education program, and local practices and supervisors in those regions. And registrars will know that they'll be training in that particular region rather than thinking they might be forced to go anywhere in New South Wales. So you're actually not forced to go anywhere. You choose which sub-region you would like to train in. So there are both general and rural pathway places, but not in all of the sub-regions. So for example, in Murrumbidgee and ACT, there are rural and general pathway places, but in Western New South Wales, there's only rural pathway places. And that's because Western New South Wales is only rural. More of this information is in the GP Synergy applicant pack. And again, just jump onto the GP Synergy website and request an applicant pack, and you'll be able to pore over all of this information. I do strongly recommend that you do that if you're interested. We're really just scratching the surface in this last few minutes here. In order to train because this is a government-funded program, there are some training location obligations. A bit like when you're in the hospital network, they are affiliated with some of the smaller hospitals in outer metro regions or in rural regions. It's the same for GP training. You can't do all of your GP training in central Sydney. You do need to move around to some outer metro or some other, maybe some rural spots. So within each of our sub-regions, we do have what we call GP Synergy training location obligations, where you might need to spend at least 6 months in one of the smaller towns. Now, you can actually do all of your training in Coonamble or all of your training in Broken Hill, because that's going to meet your training location obligation. You don't need to move around. You can actually stay in the one town. But you can't stay in the one town if that's Dubbo, because it's not really a town, it's a large regional centre. And similarly, you can't stay in the same practice if you're in Sydney. So again, jump in and have a look at the applicant pack for more details about where you're thinking that you might want to go and train, so that you understand a bit more about where you might need to go. So just really quickly in the last couple of minutes, you choose where you would like to train, and your preferences are put into our system, and those are merit-based. So if you meet the right requirements and there are enough training positions, then you'll get your sub-region of choice. If there are 20 places but 30 people that want it and you're number 28, then you won't get your first choice, but you'll be able to apply, choose your second choice, and so on and so forth. I'll leave that because that is in the applicant pack about some priority preferencing, and I'll leave that example too. But lastly, once you're in a sub-region, you get to choose which practice you might want to actually work in. So if it's a hospital term, then you apply for that hospital job just like you would if you were any other medical officer. If you are applying for a GP term, then you do that through our system. And you apply to practices tell us, I want a registrar, and registrars say, I want to work in this particular region. And then practices will actually interview registrars. So, and the registrar says, yep, I'd like to work at that practice. And the practice says, yep, I'd like to employ that registrar. And so, again, lots of choice about where you work. We'll tell you all about that when you join the program. So here's that last slide I was talking about, Anthony, with more information. So to request an applicant pack, just jump onto our website, gpsynergy.com.au. If you've got specific questions for yourself, applicant@gpsynergy.com.au, and there's some links there also for the two colleges.
Thanks, Vanessa. And I've sent that link to the applicant pack out to the attendees as well a couple of times during the webinar, so they've got the direct link there. So great. Thank you. So the only question we had was around the IMG specific thing, but I did have a particular question, was how many interns actually apply for general practice training? It always kind of strikes me that you've got to be super organized to apply your intern year for general practice. So is that kind of I'm assuming it's not the norm. I'm assuming it's more the following year that people tend to apply, do they?
It's actually about 50-50.
Oh, really?
So
okay.
About half of our applicants are interns, and then the other half are PGY2, all the way up to I've had a PGY27 before. So all sorts. But yeah, so I think a lot of that, Anthony, is around having a foot in both camps, I think. And I really encourage that, because you don't really know about general practice training until you kind of dip your toe in the water and get a bit of experience with it. So there's no strings attached. You can choose to leave. You can. So I think for us, we certainly encourage that early application. And again, if you don't get in that first time as an intern, you've certainly had that experience of doing your application. If you might have sat that exam or done an interview, and all of that just really adds to your pack of stuff that you carry around with you, and it's really valuable.
Okay, that's interesting. And I think my observation is that different hospital networks for the interns and residents have different challenges in doing sort of certain terms and things, and the JMO managers will try and prioritize your need if you're heading towards general practice. But what happens if you just can't absolutely get one of those required terms in your PGY2? How does a group like GP Synergy help you at that point?
Yeah, look, that's a really good question. And I completely agree. Our JMO managers, I think, have really clued up in the last few years in particular about the needs for general practice trainees, and really prioritising those just as much as any of the other trainees. So as long as you're told your JMO manager that that's what you need, then they really are quite accommodating. There are some things that we just can't get around, and those are things like emergency. But those generally aren't the terms you don't get. It's pretty easy to get some emergency experience. Often it's the medicine or paediatrics or surgery that you might not be able to get. And we do have alternate pathways for those. So if you've only got, say, for example, 5 weeks of a surgical term, we do have some alternatives such as doing some online modules and then providing us with some case studies. Maybe it's from doing some emergency but seeing surgical patients. And then we'll get your supervisor to step in and right at the beginning as well, just to make sure that you are safe in that particular area. So we do like to work with our doctors to see that they can be term ready. In general, if that all fell apart, having emergency experience is the number one key thing. So it might be something we'll say. So for example, Amma with the anatomical pathology background, I'd certainly suggest 3 to 6 months in the emergency department is going to get them up to speed with all of those other requirements as well.
Particularly given they're going to have to work in the rural program, not the general program.
Yeah. Exactly.
Well, again, thank you very much, Vanessa. So we thank Vanessa and we thank GP Synergy for sponsoring tonight's talk. We're going to see GP Synergy. We may see Vanessa again throughout the summit a couple more times, which is exciting. Just a reminder, our next talk will be on the 3rd of May, which is a Sunday, which will actually be the formal launch of the program. So I'll be going through all the speakers that we've got lined up and what you're going to get from the program. Please feel free to sign up for all the talks. They are free this year, thanks to the sponsors like GP Synergy. They're making it free. Please tell your friends as well, so that we get as many people getting the value out of these talks. If you're watching on the replay, remember you can ask a question on the event page. And thank you again tonight, Vanessa, and I'll wish you a good evening.
Thanks, everyone, and thanks for attending.
Thanks to all the attendees.
Good luck with your applications. Don't forget they close on the 20th of April.